welcome to Health HQ, an online showcase of the Faculty of Health and Medical Sciences degree offerings for 2023. My name is Chucky and I work in the Future Students team at the University of Adelaide. I will be your MC for the evening. Thank you all for joining us tonight on speech pathology. Tonight, you are going to have the opportunity to learn more about our speech pathology program, hearing first-hand experiences from our current students and academic staff. I'd like to start off by acknowledging and paying respects to the Kaurna people, the traditional custodians whose ancestral lands we gather on. We acknowledge the deep feelings of attachment and relationships of the Kaurna people to country, and we respect and value their past, present, and ongoing connection to the land and cultural beliefs. Moving on to the main event, I would now like to introduce you to our panelists for the evening. Panelists, when I call out your name, could you please take a moment to introduce yourselves? First up, we have Stacey Attrill.
Good evening, everyone. I'm looking forward to talking with you in a minute.
Thanks, Stacey. Next up, we have Charles Marley.
Good evening, everyone. I'm the Academic Lead for Learning and Teaching for the School of Allied Health, Science and Practice.
Thank you so much, Charles. And now we have Rachel Gibson.
Hello, everyone. My name is Rachel Gibson. I'm the Director of Allied Health here in the School of Allied Health, Science and Practice at the University of Adelaide. Welcome.
Thank you so much, Rachel. Now, moving on to our current students. Firstly, we have Tara. Moving on, we will go on to Cassie. We have Cassie Adler, and lastly, we have another current student, Michaela.
Hi everyone, I'm Michaela.
Cool, thank you so much, team. Now, over to Stacey, who will teach us more about the speech pathology program.
Hello, everyone. My name is Stacey Attrill and I'm an Associate Professor in Speech Pathology here at the University of Adelaide. I'm also the Program Coordinator for our Bachelor of Speech Pathology with honours. Our students form strong networks together and in the South Australian communities in which they're embedded. We have strong networks that have helped us to develop a really robust range of placements. And in our speech pathology program, you'll engage in over 800 hours of practice placement and study in South Australia's most complete and globally recognised health education environment. Change slides, please.
Studying speech pathology here at Adelaide will give you the capability to transform people's lives through the power of communication. You'll learn how to help people overcome a broad range of challenges to develop ways to communicate, including the physical, developmental, and cognitive. fantastic career opportunities, ready to enable people's deepest, most rewarding connections at every stage of life.
So a speech pathologist is an allied health professional who specialises in supporting people who are finding it difficult to communicate, and also those who are finding it difficult to swallowing. So we look at speech, we look at language, we look at reading and writing, we look at cognition and how people think, and we look at supporting all of those elements when there are difficulties for people, whether that's for kids who are finding it difficult to communicate, or for adults, for example, who have acquired a problem with communication, such as what happens in stroke, in diseases like motor neurone disease and multiple sclerosis, Parkinson's disease, where sometimes we're able to provide supports for them to regain their communication function. Sometimes we need to support people to use technology to support their communication. We have lots of skills in those spaces. We also work with people who are finding it difficult to swallow or to eat. We work in conjunction with several other health professionals, including occupational therapists, to support eating and feeding. But our role really is thinking about the physiology of all of these muscles from here to here, and particularly the very fine muscles that sit in the larynges, so our larynx, our voice box, which also supports our swallowing function. So it doesn't take a lot of imagination then to understand that the degree in speech pathology is really oriented around thinking about all of the underlying mechanisms that support communication and swallowing function. So it's a 4-year program with a February intake only. And the things that we look at most frequently are really around, we look very intensively at head and neck anatomy, neurophysiology, and particularly brain neurophysiology. We think a lot about communication development. We also think about what it means to lose communication if we're talking about people who have experienced some kind of disorder or disease that has resulted in that. We look at the underlying mechanisms of language and communication through linguistics. And our Faculty of Arts here at University of Adelaide is one of the strongest in the world in relation to particularly linguistics for our Aboriginal and Torres Strait Islander communities. And we've got some really close partnerships with our linguistics faculty to support our students to understand and really define and refine their understanding of linguistics. In third year particularly, we think about interventions for communication and also for swallowing. We look at voice, swallowing and eating as functions, and particularly then what it means to support that from a technological viewpoint. So one of the things that speech pathologists do that's very different to the other allied health professions is we use a lot of technology in the work that we do. So you might have seen people using devices for language, for example, kids with cerebral palsy, where they'll use a device to talk for them. They'll use their own voice through their device often, and our role is really around supporting that. There is a lot of social determinants of health. We think about how people access health, public health opportunities, and psychology, particularly the psychology of learning. So we're thinking about reteaching all the time and what it means to learn skills again or learn them for the very first time from a communication and swallowing viewpoint. One of the most important values of our school, more wholly, is our ways of thinking about culturally responsive practice for our culturally diverse communities, and how we ensure that when we're talking about health professional practice here in Australia, that we're talking about health professional practice for all of the communities that are part of the Australian community. So we spend a lot of time unpacking what it means to think and be practitioners who are able to be culturally responsive in their approach. One of the defining features of our speech pathology program here at University of Adelaide that is different to other speech pathology programs, certainly in South Australia, and there are only a few around the country, is that we have an elective. And our elective sits at the end of year 2, so it's in second semester year 2, And it's what's called a closed elective. So we've made some decisions about the kinds of areas that we're interested in students pursuing, and those are around linguistics, public health, psychology, and health sciences. And we've probably got a range of around 20 elective subjects that you can choose from. And the idea is that students go, they make decisions about what they want to have a look at, but we bring that learning together as a cohort. So we're really careful to ensure that that those very diverse learning opportunities then help us as a whole profession to think and reason in ways that are really differentiated and diverse. So it's a really important part of our course. Can I change slide, please? So if you're thinking about a 4-year course, we start with a foundation year. And the other really important value for us, aside from culturally responsive practice, is what's called interprofessional practice. So we have a school that's comprised of occupational therapy, physiotherapy, and speech pathology students. And in year 1, the courses are designed so that we all learn and teach together. And so you'll have teachers from speech, OT, and physio, and you'll be learning and working together with speech, OT, and physio students, all mixed up. And that we've decided and very deliberately planned our program around that, because the health literature tells us that outcomes are better for patients where we've prepared students well to work together and to understand what each other's roles are as health professionals. So we spend quite a lot of time thinking about how we do that. And our first year is there are 2 speech pathology specific courses, one in semester 1 and one in semester 2. And the remainder are what we call common courses, where all of our disciplines learn together. So we think about anatomy, physiology, public health, psychology, and health research courses. And there is a focus also then on introducing speech pathology as a practice, thinking about what it means to identify and be a speech pathologist. And we start with some early linguistics as well in first year. In second year, we start to think about more speech pathology specific concepts. So we're interested in what is typical and atypical communication. We apply our linguistics learning and start thinking about what that might mean in practice. And we spend quite a lot of time unpacking the anatomy from here to here with some brain stuff in there as well. So your head and neck anatomy and physiology. We think a lot more about what it means to apply knowledge and skills that are very specific to speech pathology practice. And we start to unpack what it means to assess, diagnose, and intervene with people with communication and swallowing disorders across the lifespan. So we're working with kids from 0 right through into adults that are 110-ish. We have a focus on person-centered care, so the person in the middle of our treatment rather than sort of us being the expert, and what it means for people to participate and be goal-oriented in what they want to do. So what do they want to get out of this thing? In third year, we start thinking about complex speech pathology practice, knowledge, skills, and context, and we're very much about what the diagnostic process looks like. So we think about what's diagnosed, or what we need, the reasoning that we need to have to underpin our understanding of all of the different types of communication difficulties, voice problems, problems with speech, language, and stuttering, and also difficulties with cognition as well. So difficulties with thinking and executive function. We also then overlay that with swallowing, and swallowing as a practice as well. And years 3 and 4 are where the most embedded areas of our practice placement courses are, although I'll talk to that in the next slide. So in terms of practice placements, and that's what you guys want to hear about, they start in year 2 for us. So in second semester in year 2, you'll do a community placement. And at the moment that's set as an aged care placement or an early intervention childcare placement. And the idea is that we get a sense of what it means to interact, intervene, and develop a professional identity in those spaces. The formal clinical practice program starts in year 3. And it's really designed over the 2 years to help you to meet the speech pathology competency requirements that are required to enter the profession, and that we're accredited on by Speech Pathology Australia, who are our professional body here in Australia. Across the 2 years, you'll have more than 800 hours of practice education placement, And we look at a range of different settings, locations and contexts for you to explore practice in. So that ranges from hospitals, schools, kindergartens. We talk about high schools. There are several different disability organisations, non-government organisations and private practices that we engage with. Aged care is a really important emerging area for speech pathology. And so we're really mapping our practice placements around the areas that our graduates will work today, but also in tomorrow as well. We spend a lot of time thinking about innovative placement opportunities in new practice areas, and those emergent areas for speech pathology at the moment are in areas like mental health, juvenile justice, so working in the corrections facilities, particularly with adolescents, and in new rural and emerging contexts as well, which reflect our very new areas of practice. Next slide, please. So the way that the practice placement program works is that we'll start with 20 hours of community practice in Year 2, Semester 2. In Year 3, you'll do 2 placements, one in Semester 1 and one in Semester 2, and those are a day a week, and they're embedded amongst the rest of the curriculum. So you'll do coursework on the other days of the week. We have a combination approach of an adult simulation hospital placement, which I had a lovely meeting in relation to how we're training our actors for that placement this afternoon, and an early intervention placement, which is in partnership with a health provider in the north, working with kids from 0 to 4, doing some structured assessment and intervention. So for Year 3, it's 1 child placement and 1 adult placement and a day a week. And in Year 4, what you'll do is 4 practice placements, which is actually quite different to the other programs, certainly here in South Australia and more broadly as well. What we've worked on is designing a really diverse range of placements that you'll be able to explore. So rather than having 2 major placements, we've gone with 4. So there are 4 different areas that you can think about. And we've worked on different ways to kind of combine the ways that you'll develop competency across those practice placements. So they're in a range of settings with a mixture of both child and adult practice environments. So it might be hospitals and schools. There's rural placement in there as well. And those placements, or our placements, are all competency based. So we've got a framework that we work to, which is our accreditation framework. And we will map a bunch of placement experiences for you that enable you to demonstrate the competencies required for speech pathology entry by the end of Year 4. So at the end of Year 4, you're qualified, packed and ready, off you go to work as a speech pathologist in the workforce. Next slide, please. So the qualification in speech pathology, as with other allied health professions here in Australia, is recognised Australia-wide, and it is an entry-level qualification, meaning that there's no internship, there's no extra professional work that you have to do after you qualify. You go straight to work. The qualification also translates to some other countries around the world. Although you do need to do some investigation about how that does work. The career of speech pathology is a highly in demand career at the moment, particularly with the advent of the National Disability Insurance Scheme here in Australia, which is really enabling huge opportunity for speech pathologists to explore new work and emerging work areas. So in terms of job opportunities in speech pathology, there are many. Many of our graduates will go into a National Disability Insurance Scheme type context, so a non-government organisation context or a private practice context. We also work in early childhood intervention, working with kids as they're starting to develop communication, speech, language, and particularly literacy at school. We work in the Women's and Kids Hospital, working with feeding difficulties. We work with developing brain challenges for kids as well. We work in primary care out in the communities. working particularly around what it means, the connection between communication and relationships. So how kids relate to their parents, what it means to relate to other kids, social skills development. We work in mental health. We work in aged care, and that's a particularly emergent area of the market for us at the moment. And we've always been present in the hospital system, particularly working with swallowing in the hospital system. So supporting people, for example, who have come into hospital with stroke. And one of the first things to go, unfortunately, is swallowing. So we work on rehabilitating that swallow function. Next slide, please. One of the things that we have worked on in the last 12 months is actually putting together an opportunity for students in speech pathology to complete a diploma of arts or languages alongside their speech pathology qualification. So you can do that as part of a full-time overload, but what we've also done is created a 5-year program that enables you to do the Bachelor of Speech Pathology and a diploma in an integrated way together, so that you've got the 2 of them at the end of the program. We've worked with the linguistics faculty to develop a linguistics specialist stream as a diploma for our speech pathology students, because the 2 go hand in hand. They're really complementary, and linguistics is a really important part of speech pathology practice. So if you're interested in that and you'd like to talk some more, please don't hesitate to get in touch with me. You can apply for that after you've actually entered speech pathology, so you can make the decision to enter the diploma at any time, but we've got several pathways that we've set up around that. Next slide. In terms of admissions to speech pathology, at the moment we have a guaranteed entry of an ATAR of 95 or an equivalent IB. The minimum international academic score is an ATAR of 90 with an IB equivalent of 33 and an IELTS of 8. And that's really because of the communication specialisation that sits around this particular degree. There's no prerequisites, and we really encourage diversity of thought, thinking and experience in speech pathology. So really interested in students who've come from a really broad range of backgrounds and feel really strongly that contributes to a strong growing cohort. Next slide. So I think we enter our Q&A phase, and Chucky, do you want to take from here?
Thank you so much, Stacey. That was great. It was fantastic to hear more about the speech pathology program. Excellent. So we are now going to spend some time answering any questions that come through from our audience. To get started, we can actually have our own question in there today. So what did you wish you knew before starting speech pathology? Can we have any of our current students answer that? Tara, Cassie, or
I reckon I'll take that one.
Sure.
I think between us, as Stacey mentioned, there are no prerequisites, but I think a good thing to have before starting is a little bit of a background in science, especially biology, just because the pace at which uni learns is quite different from high school. It's a pretty big change, and I think it's important that people are made aware of that. So diving into a subject that is entirely unfamiliar can be really stressful and scary. Whereas if you have a little bit of that background information, it's a lot more manageable and sort of makes the transition into university style essays and assessments much easier.
Great. Thank you so much, Tara. Anything to add, Cassie, Michaela? I think so far so good. Awesome. We can move on to the second question. So what are some things you can do during high school to prepare yourself for life at university? So I think Tara answered that as well, just a bit, but anything to add?
Do you want me to take this one, Chucky?
Yeah, go for it.
So there's a couple of things that you can do at high school level that are about just general preparation for university studies. So having an organised study kind of framework, thinking about, about how you're using a schedule from day to day and week to week is really important. because what we expect at university is, and these guys can probably talk to it more eloquently than I can, is much more self-directed ways of thinking about learning. So if you've got those skills at high school, they transfer really nicely into university, and it means you don't have to sort of do all that backwards learning to try and catch up with just organised frameworks for learning. One of the things that is useful for speech pathology can be having a language. It's not a requirement, not by any means at all, but sometimes having a language helps us to unpack some of the linguistic sort of constructs, the ways that we put language together. And that helps when we're talking about people who are finding it difficult to communicate, because it helps us to think about which bits go where when we're thinking about a sentence or when we're thinking about discourse more broadly. So a language can help. But as I said before, we really value diversity, and particularly diversity of thought. So I encourage students to come from lots of different backgrounds.
That's great. Thank you so much, Stacey. Great. So the next question is actually a bit of a fun one. Why did you choose to study at the University of Adelaide?
All right, I guess I'll take this one then. So I personally chose it because it is a great location. It's quite central compared to speech pathology has always been considered or offered at Flinders. So I chose it, one, to take a chance, and I was also previously here as Tara and Michaela as well, because all three of us come from other different pathways into uni. But I chose it, mainly for location, but also I am aware that the teaching staff, the facilities that are offered are really, really good. And if you need any sort of, support in any way, there are services there that you can just access pretty much any time, which is really, really good.
That's beautiful, Cassie. Thank you for that. Great. Let's see if we have any questions in the Q&A. And also just a reminder once again, after all of those presentations there, which were really beautiful, if you have any questions, please feel free to pop them up in our Q&A. All righty, let's have a look. Okay. So we have had a few questions come through, which is great. Thank you so much for that. Let's have a look. Yeah, so we'll go for this one. What degree would you say is the best to go into if you don't get the required ATAR so that you can defer later?
There are probably a couple of different pathways into speech pathology that make sense in terms of the kind of things that you're likely to explore, well, you will explore during the degree. Health sciences is a really good foundation health course that enables, and there is the capacity to transfer from health sciences into speech pathology, or to complete the health sciences course and then to do speech pathology afterwards. So health sciences is just a nice foundational health framework that helps you to kind of conceptualize those things in a way that makes sense to the learning that you're going to do. Linguistics is the other place. So again, it's the similarities or the kind of complementary learning between linguistics and speech pathology is quite is prominent within our program. And we've got a great relationship with our Faculty of Arts. So the linguistics program is quite prepared and understanding of students who are likely to transfer to speech path. So that makes a nice pathway as well. The other place would be a Bachelor of Science.
Great, thank you so much, Stacey. Let's have that done. We have an interesting one. Do speech pathologists learn about the entire human anatomy in the first year, or only focus on throat and nose anatomy?
So I'm good to take this one again as a second year. So yes, first year anatomy was actually really interesting in that we got to spend the semester, actually the whole year, learning about the different systems of the body, how they work and how it all fits together. And now that we've moved into second year with more of our speech focused courses, we are now focusing on the head and the neck. But it's really interesting to get that initial sort of background and learn how everything works.
Beautiful. Thank you so much. Let's go to the beginning. Let's have a look. Okay, should you still apply if you get a lower ATAR? What would the minimum ATAR be?
Do you want to take this one, Rach?
Sure. So you should absolutely always apply regardless of your ATAR to university. ATAR is one of these things that changes every year and you never know where that's going to sit. So my advice would always be to apply regardless of your ATAR and see how you go with getting in. As Stacey said, there's no prerequisites to get into the Bachelor of Speech Pathology Honours. So it's a really good opportunity to have a look at, I guess, what subjects you are doing. Diversity is so important, but please apply. You never know how it's going to end up, would be my absolute advice.
Beautiful. Thank you so much, Rachel. Great. So we have a question from Nicholas. What is a competitive GPA to get into uni from health and medical sciences?
I guess I can take this one again as well. So if you're already studying at university, generally what we look for is a competitive GPA of around 5 to transfer across. And that's right across the board for all university courses. So you should be aiming for a GPA of 5.
Thank you. All righty. So we're moving on to the placement side of things. We have one question, which is how many placements are offered in the course?
So in total, if you're looking at the placements that span from second year right through until the end of fourth year, it's 7 practice placements. But we also have a project placement, which I didn't talk about before, but does differentiate us from the other providers here in South Australia. So you've got 4 clinical placements or 4 practice placements, which in final year, which will be spread across adult and child practice areas. But we also have a project placement as well. Which is a project in which if you choose the industry stream, you'll be embedded in a community organisation and working with them to evaluate or create some community education. So it's much more of a sort of a work integrated learning framework than a traditional practice placement, and gives you an opportunity just to explore organisations in ways that you can't really grasp while you're doing a practice placement. So if you consider that one as well, then in total we're talking about 8 placements across the 3 years.
Thank you so much, Stacey. All righty. Okay, maybe one for the student panel. What are some tips from the student panel for starting university? Tara, Cassie, or Michaela, any thoughts on that?
Well, Stacey mentioned a big one, which is getting used to having your own sort of study schedule, which is really important because university, it's good fun and it's really interesting, but it doesn't really hold back a lot. You do dive in quite quickly to the amount of work you have. So it's a good idea to sort of get into good habits now. Other advice, utilize as much of the university help that's available as possible, which you'll probably learn more about when you apply. But we do have a lot of services here at Adelaide, such as writing centre and things like that. And they will really help you in the transitionary period from high school to university student. And from a speech pathology perspective, I would say probably to rely on the older year levels and the faculty quite a bit, because since we are a brand new degree, everything is, in our experience as second years, everything is still being shaped really, really quickly based on feedback from us and from our fellow first years as well. So contribute as much as you can to the environment and you'll see a lot of changes, which is always good.
That's beautiful. Thank you so much, Tara. Cool. We have an interesting one here. What has been your favorite experience so far in the degree, so in speech pathology?
I might take this one. So every year we celebrate, well, so far, we celebrate Speech Pathology Week. Last year, Stacey and some of the other lecturers and tutors put on a lunch for us where we had thick and fluids, which you'll be introduced to throughout your course. where we got to taste them, and we also got to do some, Stacey might have to help me out with the term, where we did the scoping. And you got to scope like a dummy's airway, which is really amazing because you got to manipulate the scope. But that's one of the best things I think I've done so far in the course.
If I could,
Oh yeah, go for it.
I was just going to say, if I could add to that really quickly, when we were in first year, we also got the opportunity to go to the Living Ghana Centre, I believe it's called, in Flinders, which was a day-long course on the importance of, and it taught us all about Aboriginal and Indigenous Australian culture and history. And it really gave, I think, all of us a better understanding of where we fit in and how we can help that community as health professionals. And it was a really interesting and educational experience.
Great, thank you so much. Alrighty, let's see. We have a few more questions here. I think we've answered this mostly, but if you have previous experiences that relate to this degree, can this help you get into the degree, or is it just based off ATAR?
So in general, I think what they're talking about there is RPL. Is that correct? So prior learning or recognised prior learning. So
Yes.
in general, recognised prior learning is about previous study. So if you've done previous study in which you can have credit applied, yes, there are credit processes. And particularly if you've done study in linguistics, in anatomy and physiology, and to a lesser degree in what will be psychology, sociodemographics, there is some capacity to get credit. In terms of work experience, which is the sort of the flip side of that argument, that's less so, simply because, or not simply, but we are competency outcomes based. And what that means is that in order to be assessed at entry level, we have to observe your practice, and it has to be demonstrated in a way that is fairly standardized, which means that we can't infer what's called practice that you have completed in previous experiences. So yes, there's credit for prior learning from a university viewpoint, but not for previous work experience.
Okay, that's great. And just to add to that as well, is the credit limited to the first year, or can it go on to second year, or not really?
No, theoretically, we can apply credit through second year as well. It's not terribly usual, simply because the program, the study plan is quite specific. But there are certainly students who have transferred over from other speech pathology programs where we think about credit in terms of where learning has been situated across the 3 years or the 4 years of the course. There's only a certain amount of credit that can be applied across the 4 years of the course. And beyond that, we need to be very careful about how we apply it. But theoretically, yes.
Great, thank you. Excellent. So let's have a bit of a look here. I guess this is one for our students as well. What has been your biggest challenge so far in undertaking speech pathology? Do you have anything to add, Tara, Cassie, Michaela?
I think I'll take this one because out of the three of us, I had an interesting start. I think that one of the biggest challenges for me, I come from an arts background. I actually did a diploma of arts before this. So I had no biology background whatsoever. So I think for me, one of the biggest challenges has been doing the anatomy and physiology. Now that's not to say I haven't picked it up. I have, and it's really, really interesting and loved last year and this year, particularly this year when it's become more specialized. But that's not to say it wasn't a challenge. But it's a matter of, as has been reiterated before, it's just about applying yourself and finding what works for you when it comes to your study techniques and stuff like that. So I can't stress that enough. But I would say, yeah, definitely that's been one of my biggest challenges.
Great, thank you, Cassie. Anything from Michaela?
So I looked over my cohort that I have mental health issues, and this did impact my study last year, but after arranging a meeting with Stacey, we were able to get a study plan to get me back on track And so it is really important to reach out to your cohort just to get help. All your teachers are there to help you, even if it's the minority issue. If it's a minor issue, reach out to them for your assignments to do, because they're more than happy to help change and talk you through it so you can get and stay on track.
Great, thank you so much. All right, let's see. This is a very good question. I think we can answer this from future students as well, but can an internal transfer be completed to transfer into speech pathology from another degree? The answer is no, I believe. You have to apply through SATAC and go through the formal application process, mainly because of the competitive nature of the program. Anything to add, anyone?
I'll just add, if you are studying from the University of Adelaide, there are specific quotas from the University of Adelaide to transfer over as well. So that is a specific sub-quota of students that can come in through SATAC.
Yes, thank you, Rachel.
So do apply.
Yes, that is exactly right. All right, let's have a look. So we still have a few questions in here. Another interesting one was just wondering if there are any summer bridging courses in biology if you haven't studied it in year 12.
I'm happy to take this one. The School of Biological Science and Practice doesn't actually offer any bridging courses per se, but there are lots of different ones that you can have a look at that are run through the Faculty of Health and Medical Sciences. It is something, as Cassie and Michaela and Tara have said, we do move through anatomy in first year pretty quickly, but use the support that you have from your students. The speech pathology student cohort are fantastic, in particularly supporting the first year students. So that's a really good space to learn. The other thing that the University of Adelaide offers is a PASS program, which is where you have peer assisted study support sessions. And I can't emphasize that enough for supporting students through their first year.
Thank you, Rachel. And I can actually add to that as well. So I'm currently studying health and medical sciences, and I've been to a few past sessions too, and they were really helpful. They're held almost every week, and I would highly recommend attending that. Great. Okay. Okay, so we have another interesting one here. If I do not get a high enough ATAR, what are your thoughts on doing a Bachelor of Psychology for a year before transferring to speech pathology? Would this course link in with speech pathology?
Short answer is yes. So psych is a really nice foundation for speech pathology. We spend a lot of time thinking about learning frameworks, particularly what it means to the psychology that sits behind how it is that we teach new skills. So psychology is a really important kind of foundation space for us. From a research viewpoint, and Charles and I speak from the same message here, we use psychology theories really regularly in speech pathology research. So it's a lovely foundation space.
That's lovely. Thank you, Stacey. Okay, so another one on placements. Do you get a preference for placement? For example, aged care or early childhood?
So there will be a preference process, but it's not the only thing that will determine where or how the placement will be enacted. So because we're competency-based, there are certain things that we need to achieve and have demonstrated in placement across the placement program in order for students to be assessed at the entry-level requirements for speech pathology entry and speech pathology practice. And what that means is that we have to very carefully map each student's placement progress across all of the placements to make sure that at the end of the program, they've met the requirements. So while preference is important and it will be taken into account, it's not the only thing.
Great, thank you so much once again, Stacey. Excellent. So we have a few more minutes remaining, everyone. So if you have any more questions, please feel free to use the Q&A function at the bottom of your screen. We'll be more than happy to answer any questions we receive. All right, let's go on to, okay, so we did have a bit of a chat about placements. Great, so What are some extracurricular activities you can get involved in during your time at the University of Adelaide?
I think I might be best to take this one.
Sure.
I am actually the president of the recently established University of Adelaide Speech Pathology Student Society. It is a mouthful, we apologise, but we are in the process of organising social events for speech pathology students. So at the minute that includes Uni Adelaide's first ever Allied Health Ball, which we're in the process of organising, as well as things like bake sales, pub crawls, quiz nights. We have a lot of plans sort of developing in our minds as we go, and we love to hear contributions from new students. So if you do come with us next year, we'd love to hear your plans. And we also work a lot, as Stacey mentioned earlier, I believe, we work pretty closely with the other allied health branches to make these events happen. So you'll pretty often find us supporting the occupational therapists and the physios as well with their events, and they'll also come to ours. And for bigger events, we usually join together and just do like meet and greets, make sure everyone's as comfortable as possible. And yeah, it's been really successful so far, and we have high hopes for the future as well.
That's exciting to hear. Hopefully that's a message for any future students. You would definitely be encouraged to join the club there. And yeah, there's so many benefits there. Thank you for that, Tara. Hopefully it all goes well. Great. So let's have a bit of a look here. We have a few more minutes for any questions coming through. Let's see. We might have touched on this before, but for the students, Tara, Michaela, and Cassie, can you tell us why you chose to do speech pathology?
Is it okay if I go first and then I'll hand over to one of the others?
Yeah, go for it.
Fantastic. Me personally, like Michaela and Cassie, I didn't come directly into speech pathology from high school. I had a bit of a convoluted route to get into this degree, but it was a mixture of luck and I would say a bit of divine intervention probably, because what really drew me to it was the fact that you're helping someone with a very fundamental part of their livelihood, and which was the initial sort of attraction for me. And then learning more about it in first year, what really has sort of kept me in it is knowing that you can work with anyone across the span of their whole life. It sort of, to me, meant that there was never really going to be a stage where there's nothing more to learn. There's always going to be somewhere you can better yourself, which I find really exciting.
That's great. Thank you, Tara. Anything from Cassie, Michaela?
Yeah, I guess I'll jump in. So the reason I chose doing speech pathology was my aunt is a speech path. And just before I started and I finished high school, I actually followed her around for a couple of weeks doing some work experience, trying to figure out what I wanted to do. And I guess what drew me to it was she works in a school, and within the 2 weeks that I was there, the absolute changes that these kids went through and what they were learning and the skills that they were picking up, to be an observer and to watch it and to watch these kids grow was absolutely incredible and an awesome thing to watch and experience. And then jumping in and starting first year, I think that drew me in even more. Jumping off of the fact of what Tara said, you get to work with literally anybody, but also working in different areas as well. You can go into the education department, you can go into school, you can do hospitals, you can do private practice, you can do aged care, you can go anywhere. And it doesn't have to be in one place forever. You can start somewhere and then go somewhere else, which I think is a really, really cool aspect of what is going to be our future jobs, because it means that we can work with so many different people and make such an awesome impact on their lives, which I know all of us are really excited about.
Thank you, Cassie. That was lovely. And anything to add, Michaela?
So originally I actually had no clue what I wanted to do. All I wanted to do was allied health. Where within allied health? No clue. So when I got the offer for speech path, I jumped at it. I got really excited. I was like, this is something. So I originally came from health med, and health med is a really broad degree. There's no pathway, I guess, to a specific degree. It's what you take from it. So I was just excited to get into something and get on a path. And once getting into it and starting to make friendships, find my place in the uni and getting involved in the courses, I was then able to go, well, this is what I wanted to do. and it just helped me figure out what I want to do, and the lecturers are there to help you, and it was amazing.
Thank you so much, all three of you. That was beautiful. Excellent. So I think it's time we start wrapping up. That brings us to the end of the speech pathology session of the Health HQ event. If you have further questions or if you'd like to reach out to us at the Future Students team, feel free to direct these to start@adelaide.edu.au. That's our email address. And make sure to have the subject Health HQ so that we can get to you much faster than anticipated. So we will anticipate to get back to you within 48 hours. If you are interested in attending a similar session to tonight, we would love to see you on campus for our open day, which will actually be held on Sunday, the 14th of August. I highly recommend popping this into your diary, as it is a really good experience, and you can actually explore the campus, speak to members of the faculties, and have a bit of a look through all the amazing facilities and resources we do offer. So please feel free to keep an eye out on our open day website if you are interested. And that about wraps up everything tonight. I'd like to thank all of our panelists today. Thank you to our academic staff and our current students. All the best with your studies, everyone. And thank you for your time this evening, everyone in the audience. Thank you for joining us, and I hope you have a really good night.